Perfect. Thanks.
Very good. And about how long would you like me to visit with everybody today?
Maybe 10 to 15 minutes, if that's enough time, or feel free to
Yep.
go longer if you'd like.
All right, we'll go speedy quick. So,
Okay.
all right.
Take as much time as you have, or as you need, because I think this is the only presentation we have today. So if you need longer, feel free.
No problem. No problem. All right, I'll go ahead and share my screen. Can everybody see that? Wonderful. Very good. All right, so Jane and I are going to tag team today. Star, thank you so much for inviting me to today's group. I'm really excited to visit with you all and perhaps have some discussion about some of your goals and what you're trying to accomplish. And I think that Wyoming 211 definitely can be a partner in the work that you are working toward in developing an information hub and really accumulating those cancer resources for the state of Wyoming and those individuals who need access to those. So today I'm just going to go through just as an overview for those of you who aren't familiar with Wyoming 211. So we'll talk about who we are, how we operate. We're going to talk a little bit about service providers and how we can get services added into our database or updated in our database. And then talk about a couple of initiatives that we have going on that may be of interest to you as well, as it relates to an information hub. So I'll go ahead and get started here. I can get my slides to, there we go. Very good. All right. So as a brief overview, Wyoming 211 started in Wyoming back in 2011. We started with 11 counties, and now we operate in all 23 counties across the state. For those of you who are not familiar, we are a statewide comprehensive provider of information and referral. So we work with those individuals who really are looking for those basic needs, such as essential services, food, shelter, health insurance, health services, employment assistance, and of course, so much more. We maintain a database that provides all of those resources in our so that we can make those referrals. And right now we have over 2,700 resources statewide. We also provide information to communities on gaps in services and data. So we're able to aggregate information that we collect when we visit with individuals who need assistance, and then we're able to share that out with communities. And then we also are a partner in disaster recovery. When I started back in 2018, there were 3 of us. I had 2 community resource specialists and the executive director position. So over the last 5 years, we have grown exponentially. We are up to, I think, 11 staff now. So I'm really excited about the work that we've been doing, the public awareness that we're creating across the state. And again, just really trying to create initiatives to meet people where they're at and really to help those service providers across the state get connected with individuals who need their services. So our call center is located in Cheyenne, Wyoming. We are, again, statewide, but we have just one call center. We provide live support to individuals through our call center Monday through Thursday, 8 to 6, and then Fridays, 8 to 5. Individuals can also reach us by texting us to 898-211. And then we have a website that's available, obviously, 24/7 for individuals who are seeking resources independently. One neat thing about our new website is that we have translation services on the website as well as accessibility. And then we also have a third-party translation service that our community resource specialists can work with. So if somebody is reaching out to us that does not speak English, we can utilize a language translation service. So how does the 211 system work? I like to call ourselves basically a one-stop shop because individuals can come to Wyoming 211 and visit with our community resource specialists and receive more than that initial resource that they think that they're needing assistance on. I love to share this story because I think it's really telling. When I first started, I sat down with a funder and was talking about 211, and how we're a call center. And she said, well, that's great. But you know what? We're in the 21st century and everybody uses the internet. And so people can Google resources. And I said, absolutely, they can Google and find resources that way. But when you're in crisis mode, you don't really recognize what all of those other things are that are going on in your life. So here's an example. A woman reaches out to 211 and she is just panicked because she received an electricity shutoff notice. And she went on to tell our community resource specialist that she's scared. She just simply doesn't know what to do because her husband just left her with 2 little kids at home. She doesn't have a job. She's never worked a day in her life. And one of her kids is having behavioral issues because dad left. And there's just so much going on in her life. But the first thing that she really needed to do is take care of her electricity bill. And she needed help paying that. So listening to her story, we're able to listen to her with empathy and then hopefully find some solutions that will help reach all of her needs that she talked about, even though she only really called for electricity assistance. So in the course of that conversation, we learned that she's never worked, so we can get her connected to job training, such as Climb Wyoming. We can get her connected to counseling services. Perhaps she would be interested in speaking with somebody or having her child speak with somebody because her husband just left. We're able to get her connected to food pantries so that she can fill up her pantry, or a soup kitchen so that she can have a hot meal. We can also get her connected to Salvation Army or to some other service that can assist her with her utility bill. So in one stop, this woman is able to walk away with multiple resources to help meet her needs, where she only realized that she needed help with her electricity bills. So a one-stop shop for all services. So here's a really quick snapshot of the resources in our database. You can see that we have everything from immunizations to sheriff departments to YMCAs, and we even have a veterans fly fishing group in our database that works with those individuals with PTSD or disabilities, teaches them how to tie flies, build rods, take some fishing, and so on, just like Mary was talking about. So we have a wide expanse of resources. We categorize them based off of taxonomy services. So all of the resources that come into our database, people can search by what it is that they're looking for. So if they're looking for bus fare, it will show up as bus fare. We want to be as explicit or specific as possible. So I think that this is really important to talk about. Who can benefit from using Wyoming 211? Essentially, everybody can benefit, whether you are an individual in need or individuals such as yourselves who are trying to find resources or have a single location to store all of those resources. We really want to meet people where they're at. And so we'll work with case managers and caregivers to find resources or find solutions for individuals that they're caring for. We'll have a 3-way conversation with our community resource specialists to think outside of the box, to come up with some solutions for individuals in need. We work with grandparents in need of assistance for their grandchildren, families seeking assistance or services for their kiddos, law enforcement officers because they constantly are dealing with victims and such, and so many more people. So I think you understand that we really are a service for everybody, depending on what end of the need or the spectrum that they're at. We can still provide resources and get them to those people who need them the most. So we have an online database search function also. So if individuals don't want to reach out to 211 and speak to a live human, they can go onto our database and they can enter in what it is that they're looking for. They can enter in the county that they live in, and it will take them to a GIS map and a listing of resources that are available to them. I want to put a disclaimer on this slide. In the next week or two, we are going to be upgrading to a new search engine, and I'm going to talk about that here in just a couple of minutes. But the essence behind the search engines are the same. You're going to input what it is that you're looking for. The output and the results will be a GIS map, as well as a listing of all resources. In our current resource search engine, you will be able to scroll down where I show the live links. There's a listing of resources below there. And so you can kind of scroll through there to find services after reading the description as to what might fit your needs the best. You can click on Counseling and Campus Wellness, which is the service that is provided, and it'll take you then to the service page, excuse me, that has the meat of our resources in our database. It talks about the service details. It will provide you with the eligibility, the application process, documents required if the service providers share that information, a fee structure if the service provider provides that information, service description, hours of operation, contact information, and so on. So this search engine, as well as our new search engine, will have all of this information available to you online. When somebody calls 211, they will get this information and more. We can talk through really what best meets the needs of the client and what best meets the eligibility for clients and the service provider. So I'm going to stop sharing my screen really quick, and I'm going to turn it over to Jane, and she's going to talk about service providers and the ability that we've provided to them online to add and update their agency. So I'm going to stop sharing. I'm going to let Jane go ahead and share her screen, and we're going to do just a quick live view of our website so that we can kind of walk you through. If you are not in our database and you're interested in being in our database, or if you have a service in our database already, how do you go about updating it? So I'll pass it over to Jane.
Okay, so here is our new website, and for anybody that is looking at seeing if they are included or want to add their information, we have this information right here for service providers that we ask everybody go into. When it goes to that, then we have a listing here that will say how you can add your agency, update your information. Anybody new coming in, we ask everyone to come down here and read our inclusion criteria policy. Now, know that this is going to be changing. We're going to have a video here as to what it takes to be included. So we ask everybody to look at this. And then if we go back up, they can either add their agency or update, depending on if they're in or not. When updating your agency, you can click this to go to now, and it gives you the instructions on how to go and search for that, which will be here through this link. When that opens up, it opens up another tab, and then it gives you the ability to come here and search. Now well, up here is the tool for service providers. If you wish to look at or update your agency listing, you would go here to update agency, and then that oh, okay, this moved it around. Sorry. That's the first. So sorry,
Something's not working there.
yeah, something's broken. Sorry about that. Well, I would show you this. However,
Click here, Jane. Yep.
click, okay. I apologize, everyone.
We just got converted over to this new website, so bear with us here. There we are.
So this is how you add a new one. It doesn't update the information. I apologize in that I don't have a way for you to search that right now. We got to get that fixed. So, but going back here, if you wanted to add your agency, of course, that then will bring you to this page, and you click that here to add your agency. And it just, once that what happens is it brings you to this screen here, and then you would fill out your information. Any information that has a red asterisk is a mandatory field that gives us the ability to know who I'm talking with when they've submitted this information. It kind of helps me because sometimes we've had people from the public that have tried to send in information on agencies, and if they aren't with that agency, it's our way of quality and making sure we get good resources within our database. When you click through this, of course, we ask that you fill out as much of these fields as possible. And then at the top, it will give you tabs that you would fill out. So then it gives you the site address and pertinent information to go along with that, as well as the available services that you add. Now, when you're in here, as much information that can be filled out as possible is great. If not, when this gets submitted, then what we'll do is we have to create, our resources are broken into 3 different categories, an agency, a service, and a site page. So the service page is the bulk of the information, and that will get broken down by these. Now, if there's additional services, it'll allow you to add 3 different 3 different services underneath that agency. If there's more, then we will work together on that, and we can add as many as you need for that service. This information will then, once I receive this page, this is our agency page to send in, I then will break down and create the site and service pages and send that back out for you to fill out. If there's any blanks, we ask that you fill that out. I will email you information as to what we would need, and we're here to help. We want to make sure that we reflect as much good information, so that way when we get callers calling in, they then get the information. We don't want to redirect or direct them to you inappropriately. So that's the reason why we ask a lot of these questions. When it comes to any cancer services, then we also, I have certain terms that I can use to add that and make it stand out more for anybody that's searching for cancer resources. I don't know, whatever we can do, we're here to help and get that information up for you.
Perfect. Thank you, Jane. So as Jane mentioned, I had this conversation with Star about adding in all of the different cancer resources. And so that is just a quick overview as to how we would go about doing that with you to make sure that we have a comprehensive listing of all of the cancer resources available in the state of Wyoming. While we weren't able to show how to see if your resource is already in our database, by all means, I would just encourage you to reach out to Jane and we can do the searching for you. We'll get our website link fixed there. But having a conversation with Jane, and then we can get it updated or added. So it's a pretty simple process and not too daunting. And the great thing about it is that, once you have gone back and forth, we can get it activated within 24 hours or sooner. So very seamless. It's not a difficult process. So Jane, thank you so much for getting that added. I'm going to go ahead and share my screen again and just cruise through that. Some of the other things that Wyoming 211 provides is data. So we can identify how often resources are referred. So if that is information that you would be interested in, we can report out on resources, presenting needs, and provide that information to you. We also do follow-ups with our clients that reach out to us, and then we can compile the data into infographics, and then as well as in just regular graphics that would make sense to anybody who's utilizing them. We also have a real-time data dashboard that if you're just looking to see what's happening in your community, you can go to our 211 counts real-time dashboard and identify, or you can look at what the top presenting needs are in a community during a time frame, if you're interested in that information. I'm going to pass through disaster, crisis, and response. We are also a part of Enroll Wyoming, where we are the centralized access point or front door for Enroll Wyoming. So we assist individuals who are seeking health insurance. We can go through the basic eligibility with individuals, determine whether they are eligible for the marketplace or Medicare or Medicaid, or if they fall into that gap. And if the consumer calls and they need more information or a greater assistance with the enrollment application, we can refer them then to Enroll Wyoming. We have a ride transportation access program that's available in Albany, Laramie, and Natrona counties. And then we also have a Kinship Connections program where we are working with kinship caregivers. And those are individuals who are relatives helping care for somebody else's children. And then we just started an ADRC program. which is an Aging and Disability Resource Center. So we're very excited about that. I hired a navigator last week who will help us do a higher level of information and referral and case management with individuals who are aging adults or those with disabilities. And so we can do any one of these services: application assistance, transition services, short-term service coordination, dementia, consultation, options counseling, and enhanced information and referral. We're also taking over the ADRC website that is currently housed at the University of Wyoming. So we'll be working on that project for the next couple of months. And then we're also working on projects of resource data sharing. And so this is one of the areas where I think that we could really help the Cancer Coalition with regard to your information hub. With our new website and search engine, we are able to utilize the search engine tool and share it with agencies or organizations that are perhaps interested in having their own resource center, if you will. And as Star had shared with me, I'm going to stop sharing. As she had shared with me, it sounds like your group is interested in having an information hub housed somewhere that has specific resources related to cancer survivors and assisting them find those resources that they can't generally easily find. And so we want to be able to help with that. Our new search engine has a URL that we would be able to share out with your organization. It would come at a cost, however, of $500 a month, because it costs to have the organization who built it to manage it. We would power it with resources, and it would work through an API type process. But the beauty of this URL is that we can embed it on your website or whomever's website, and then we can brand it so that it looks like your organization. It wouldn't look like Wyoming 211. So I want to share with you Washington 211 has this URL. And so I think that I can give you just a quick example as to what it would look like if we were to utilize this search engine here. So here's Washington 211. They're using the same infrastructure for resource sharing. So right here is the URL. So you'll see search.wa211.org. What do you need help with? You can identify a listing of services. So anything that is commonly sought out for by cancer survivors or those who are faced with cancer. You can develop different questions here that would be applicable to this population. And then it would guide them to the taxonomy behind them. And it would provide them with a listing of resources. So this is very similar to what I showed you with our current resource search engine, and this is what we are converting to. So more information on the different resources, and it covers the eligibility, application fees, and so on, like I had described earlier. So when you look at this search engine, here is Team Link in Washington. They used the same URL process, but they were able to embed it into their website so that it looks like them. They tailored it to teenagers, which is their population, and they have all of these questions that are applicable to the teenager. So when you click on one of those options and hit search, again, it takes them to all of the different types of services that correspond to that question. So we can set this up the same way for the cancer resources and develop questions that are related to this population. And it would be, I think, a user-friendly option for an information hub for you and for the audience that we're working with here. So I just wanted to share that with you today, because I think that it's really, it's a powerful tool, and I think that it could really be beneficial. Sorry about that. So those are some of the things that we have going on. We've got a lot of other projects that are happening, but think I've used up my time. And so I wanted to pass it back to Star to see if she had any questions or if any of you have questions for us today.
Hi, Sabrina, it's Lee and Gillette. Just curious on the travel help in those 4 counties.
Yes.
Is that just in those counties because they've already set up, how am I trying to say this? It's been a Monday already. Because they specifically have groups built into their communities that help with travel.
So the Ride Transportation Access Program is a partnership between United Way Worldwide and Lyft.
Okay.
So at this point in time, Albany County, Natrona County, and Laramie County are the only counties that have Lyft services. But I want to present that in all counties because if we can get Lyft drivers to sign on, then these dollars would be made available to any other county that got Lyft drivers. So that was why I wanted to present that today.
Yeah, because we struggle with that here in Campbell County. We've got like 2 taxis, I think, maybe, or 3, and it's, they're busy or they don't answer. So we just have a hard time finding consistent help. So I was just curious what we need to do, I guess, to maybe reach out to Lyft drivers here.
Yeah, I think that this is something that we can certainly collaborate on. I think some of the other states across the country utilizing this program has put out some initiatives to help get Lyft drivers on board so that we can help resolve some of the transportation barriers that we're facing. One thing that I might add is that this is not a long distance solution or a long-term solution. It really is about kind of a last resource. Looking at all of the other transportation programs in each county, and if there aren't, then this will be the only resource. But it definitely is not for a long distance solution. Just getting you around the community to different doctor's appointments and such. And there's also a listing of case uses. So it can be used for medical, legal, housing, education. I think I'm missing another one. Oh, economic stability. So, and food. So those are the parameters around that program as well.
Great, thanks. Well, Rhonda or myself might reach out to you and see if we can get some help with that in Campbell County. She's our navigator.
Yes, perfect.
Thanks.
Anyone else have any other questions for Sabrina or Jane? So one of the asks is that in order to do this resource repository or the future one that Sabrina presented, we would really have to build a robust listing of resources available in Wyoming. And so for those of you who already do connect people with resources, you may already have like your go-to list. And so our ask from the coalition work group and Wyoming 211 is to have those resources register at Wyoming 211 if they are not already. And so if each person that does work with community type resources, or they help navigate people to an application or to a website or to another person to connect them with a resource, if you can reach out and ask them to fill out the form for Wyoming 211 and get registered on their website, then we can kind of build this little section that's cancer specific. And then that will show us whether or not we need that separate URL that Sabrina was talking about, or if most of the organizations that we already utilize are on Wyoming 211, then that will help us know, kind of where the starting point is and what we need to do. So that would be kind of the next step, is to start identifying what resources needed to be added to that list. So we can have our repository list that we are hoping for. Thoughts, questions, anything